All right, tell me a little bit about yourself.
My name's Amanda. I'm 33 years old. I like to write, I like to scrapbook. I'm a daughter, a sister, and unfortunately, I'm a childless mother. And I've vowed to be an advocate to break the silence around this subject that's so avoided.
How long have you wanted to have children of your own?
Probably from the time I can remember. I remember as a kid, I've always said that I was going to have a lot of children. My oldest sister had her first baby when I was 13, and at that time I was having a baby in the house. That was it. I knew that was the one thing I wanted more than anything.
When did you first discover you might not be able to have children?
When I was almost 16, I was diagnosed with polycystic ovarian syndrome, and I was told that it was a reproductive disease that I would never be able to have a child.
How did this discovery affect you?
At first, it really didn't sink in. It took a while for it to actually take effect. I mean, to the point where I even offered to be a surrogate for my doctor after finding out this news. But when my sister had her second daughter and I got to hold her, it hurt.
And how did your family react to all of this?
I think a lot of it was still the same. They knew I wanted kids, but it didn't fully sink in until I started trying to have babies that it may never happen.
Right. Did you ever consider adoption or surrogacy?
I did. I've looked into both. Unfortunately, the way the system is with adoptions, it makes it hard to financially afford it. And then with surrogacy, there's extra cost associated with that, but none of them have lack of risk. There's risk for everything. You risk the adoption not falling through after your heart's set on it. And with surrogacy, if something happens, you're asking another person to bear a pain that is not theirs to bear.
Right. What steps did you take to achieve your dream of motherhood?
I've done a lot of rounds of Clomid, which is the fertility drugs, to try to get pregnant. I've sought out a lot of different doctors, holistic medicines. Finally found a doctor here that was willing to try to help.
And what kind of success did you experience?
March of 2016, we did my second round of IUI doing donor sperm, and the first round failed. So I started taking injectable medicine. We found out injectable medicines helped me ovulate, because we found out I didn't ovulate for 11 years, and was able to, on March 19th, conceive.
Okay. Tell me something about your first pregnancy.
Like I said, March 19th was my conception date. I actually took a pregnancy test of all days, April Fool's Day. Felt really awkward to tell everybody on April Fool's Day that I took a had a positive pregnancy test. Went to the doctors, they confirmed it, went back a couple days later to do a second blood draw. My HCG was rising, so since I was in fertility treatments, they do early scans. At 6 weeks, they told me that the babies I was having twins, but I was bleeding. But both babies looked good. They still had their fetal poles. I was to come back at 7 weeks to confirm or deny heartbeats. So at 7 weeks, I went back. I was still bleeding off and on, and I was told my body had reabsorbed my twins.
That must have been really tough. What steps did you take following your loss?
Well, I went through a lot after the loss. I had some harassment at work and things like that, but once my body was healed, I went right back into the fertility treatments and started again with the 3 months of birth control to prep my body, the injectable shots daily, twice daily, and was able to go back to the fertility treatments and ended up conceiving triplets on August 9th.
Wow. So tell me something about the process from this point. What did your fertility doctor tell you to do?
Well, there's a little bit of a back history. Like I said, I'm in fertility treatment. So at 6 weeks, they told me that my HCG wasn't rising the way they wanted it to, and they thought I was having an ectopic pregnancy. Right. So they called me in, and that's when we found out it was triplets. But only one had a heartbeat. So I had to go back at 7 weeks again to decide whether or not it was a viable pregnancy. I went back at 7 weeks. All 3 babies had heartbeats. And they told me that 2 of them was measuring a week behind, that there was a possibility I would lose them. To prepare for that, he recommended me to go to a high-risk doctor, maternal fetal medicine, because I'm diabetic. I've had a previous loss of multiples, and I was carrying a high-order multiples. So he told me to make sure that I stayed on my prenatals, to continue with my metformin for the PCOS, and to make sure I went to all of my appointments with my high-risk OB.
All right. And you got a referral at that time?
Yes.
So tell me something about your first appointment with this OB/GYN.
It took me until I was 11 weeks to actually get in with the OB. So from the 7-week mark, leaving my fertility doctor, until 11 weeks, I had no prenatal care or anything like that. My first appointment with them was an extremely long appointment. It was almost 4 hours that we were there.
Right.
They did an intake, your past medical history, talked about the loss of my twins, and then I met with Angelin, who went over my nutrition, went over some preterm labor information, since I was carrying triplets, that was pretty much guaranteed that they would be born before 40 weeks. I'd mentioned that I'd had some spotting, some little pink tinged discharge, some cramping and things like that, because I'd never gotten this far along in the pregnancy. And all they did was tell me that everything looked good, that everything I was feeling was normal, and that was pretty much it. Then my first appointment was all with Angelin, who is their nutritional educator and their preterm labor educator.
So you didn't actually see a doctor at that?
No.
Okay. What prompted your visit to the emergency room in late October?
Late October, I started bleeding. I woke up in the morning kind of uneasy, and went to the bathroom, and I had some bright red blood. I made a call to the high-risk OB. They're on call. Dr. Baker called me back, told me at 13 weeks if I was miscarrying, there was nothing they could really do. I had an appointment on the 11th of November. He told me I can either keep that appointment, or if I really felt uneasy about it, I can come to the emergency room. So I, after losing the twins and bleeding, the sight of blood, and then just kind of flipped me out. Then I went back to the bathroom, and I passed a clot. And at that point, I had to go. There was no choice but to go to the ER, because I had to know if something was going wrong.
Right. But just to be clear, your OB/GYN did not ask you to come in to see them.
No.
They suggested you go to the emergency.
No, they told me just to keep my appointment for the 11th, or go to the emergency room if I needed to know if something was going wrong.
Okay. All right. What steps did your doctor take to rule out infection of any kind?
I don't know if they did take any kind of steps to rule out infection. They called me on November 3rd, told me they got my records from Wayne Memorial, and that everything looked good, and that they just go ahead and keep my appointment for November 11th.
Okay. How many times did you actually see your OB/GYN?
The actual doctor themselves, or
exactly
the nurse practitioner that I kept seeing?
Both.
The nurse practitioner, I've had 5 appointments. I saw 3 different doctors briefly, just when they were adding medicines. I saw Dr. Royak long enough for him to tell me he was putting me on insulin, and which insulin he was putting me on. I saw Dr. Reddick long enough for her to tell me that the nurse that examined me found a clogged milk duct, so she came in and told me how to take care of a clogged milk duct. And then I saw Dr. Baker on the 23rd to tell me that to prepare to lose my babies.
And how many appointments did you have at the practice in November?
2.
2.
November 11th and November 23rd.
And just to be clear, you were told several times that you were considered a high risk.
I was told I was extremely high risk, being diabetic and carrying high order multiples.
Okay. At each of your appointments in November, what was discussed with you?
November 11th was a very rushed appointment. When I went in on November 11th, they had also scheduled an EKG, ECG at around the same time as my OB-GYN appointment. So they did their routine ultrasound, measured their heart rate, said that all their heart rates looked good. And I met with Angeline briefly just for her to tell me that they wanted to increase my insulin intake because of my blood sugar numbers. We went over my log that they had me keep of what my blood sugars were, and after that they sent me out the door to go get my ECG and EKG. I mean, there was nothing really discussed at it.
Okay. And what about the late November appointment?
The November 23rd appointment, that appointment was kind of bittersweet. My second niece was the first child to call me mama, so I was excited because she got to go with me for the first time to an ultrasound to see my babies. So it was kind of a bittersweet appointment. During the ultrasound, they told me that my cervix was open. Didn't know what that meant at that point. I mean, I knew it wasn't the greatest. Yeah. So Angeline came in and did a speculum exam, said that I was 3 centimeters dilated. I had Dr. Baker come in just to tell me to prepare to lose my babies.
And what did you do at that time?
Asked them what all was possible to have them help me prepare to prolong the pregnancy. I asked them if there was anything that they could do. At that point, he told me that there was controversy over any kind of treatment with high order multiples, but I was willing to take any chance. So he sent me home with vaginal progesterone, told me that my cervix was too active to do a cerclage, that I needed to come back in a week, and if the vaginal progesterone had made my cervix stop moving, that there was a possibility that they could do a cerclage. So I went home with the vaginal progesterone and started doing a lot of research on the shortened cervix. Found out that vaginal progesterone usually don't work, but shots, if you took the shots are more effective. Found out about Trendelenburg position, that they can put you in where you're laying halfway upside down. Dad decided to use carjacks and put my bed in a homemade Trendelenburg. Had his little measuring thing out there to make sure it was right at the 45-degree angle, and pretty much stayed that way all throughout Thanksgiving Day, the entire weekend. Stayed laying there in Trendelenburg researching different things that could be done, including the cerclage. And there was a lot of controversy on whether or not it would help with multiples, but there was no proof that it wouldn't. So I did a lot of research on that, and then I called the day after Thanksgiving on that Friday, November 25th, and asked them to go ahead and do the cerclage, that I felt that the benefits could outweigh the risk. That even if my cervix was active and they had to tug and pull a little bit, that I was willing to take that chance if it meant I could save my babies.
Right. So you left a message for the practice on November 25th. Was that phone call ever returned?
No. And later that day I called and they still never answered the phone either.
All right. Tell me about the morning of November 28th.
Like I said, I was sleeping in Trendelenburg. So I just kind of was restless that night, and I kind of got up to go to the bathroom in the morning. After I went to the bathroom, I stood up and I still felt like I had to pee, and I tried to lay back down, but I was still restless, and I was trying to tell myself that it was just because I was laying upside down that I was so restless, but something just didn't feel right. Yeah. And in one of the books that I was reading about, the incompetent cervix and stuff like that, when I was doing the research over the weekend, said that even if you just emotionally don't feel right, just to go. So I asked my parents to take me into the emergency room. Yeah. I called Dr. Reddick, was the on-call for Savannah Perinatology. She called me back, and I told her I was already on my way to the hospital. She told me to go straight to labor and delivery, that she'd have Dr. Leapart waiting for me when I got there. We got to labor and delivery. The only doctor there was Dr. Shepard, which is their resident, and she did a speculum exam, said that I was 3 centimeters dilated, but she didn't see any membranes or anything like that at the opening, and I wasn't having contractions or anything. So I asked her if she could do a rescue cerclage, because I'd already read up on it, and as long as you weren't contracting, the membranes weren't bulging out, and you were less than 3, or you wasn't more than 3 centimeters dilated, that a rescue cerclage could help.
What did they tell you?
She told me I had to wait and talk to Dr. Leapart, who was the attending physician.
Okay. So tell me something about your visit with Dr. Leapart.
She came in probably around 9:15 that morning, and pretty much told me at 18 weeks there was no hope at all to save my children. That the only thing that she could offer at that point was to give me Pitocin to go ahead and terminate and get it over with. I told her no, that wasn't an acceptable answer to me. And as long as they were in me and they weren't coming out, they were safe, and that's how they were going to stay. And they were going to do everything in their power to save them, and I would do everything that I could to save them. So I asked her about the cerclage, and she ignored it and told me that most women in my position just take the Pitocin and get it over with and go home.
Did you ever agree to the administration of Pitocin?
No, I've absolutely refused Pitocin. I've read so much research on Pitocin, on the side effects, on how it can make contractions worse, how it can make you bleed worse. I absolutely, even in my birth plan that I gave them at my very first appointment, I already had my birth plan laid out that Pitocin was never to be administered.
How many more times did you see Dr. Leapart during your hospital stay?
2. I saw her on Wednesday morning when my contractions started, where she offered me Pitocin again, and then I saw her the day I was getting discharged.
Okay. Tell me something about what happened after Dr. Leapart left your room the morning of the 28th.
Pretty much I was just left there. I saw Dr. Shepard one other time. They said they wasn't going to do any kind of cervical exams or anything like that. They were just going to do expectant care and just let everything happen naturally on its own, the way it was supposed to naturally happen. My sister came in later that night because we kept telling her that I smelled really bad when I would go to the bathroom. It just had a weird smell. And my sister actually told the nurse that I stink. And they told me no. So we asked about antibiotics. They said no. I called Dr. Brown in Augusta and asked him for a second opinion. Dr. Brown actually got on the phone and talked with my sister and told her that I should be on antibiotics, and that as long as I wasn't in labor, there was a possibility that a cerclage could help. We were going to transfer up to Augusta, but his concern was that if my water had broke or I went into labor in the 3-hour ambulance ride, that the paramedics wouldn't be equipped to handle a triplet delivery or any complications that may arise. But pretty much the 28th is just, they really didn't do anything unless I asked them to come in to check, come in to help me go to the bathroom or anything.
Okay. Did they explain to you, you used the term expectant care, did they explain to you what that meant, what that entailed?
They said that it was just let whatever happened naturally happen.
Were you on any fetal monitor at that point?
I was on a contraction monitor, but no fetal monitor. I did ask about the fetal heart rate monitor, and they said that they can't determine between 3 different heartbeats, so there was no point in putting the fetal heart rate monitor on me.
Okay. Tell me about what happened on November 29th.
That next morning, Dr. Shepard came in and asked me how I was feeling. Told her okay, because the night before my water had broke. That Monday night, around 6:30, my water had broke. So they came in that Tuesday, and They did an ultrasound. I was able to find out the genders of my babies. 2 boys, 1 girl. So we gave them names because I got tired of hearing everybody call them a non-viable fetus. So they were named, and everybody was instructed to start referring to my children by name. They started doing a lot of, the night before, a lot of pain medicines. They started giving me morphine, Ativan, Stadol, Phenergan, and that continued through the 29th. Dr. Shepard came in and did a exam sometime in the afternoon and told me that baby Dennis's hand was completely out of the vagina. So I knew at that point.
Now, did they start you on antibiotics after your water broke?
No.
Okay.
So we knew on that day that we were going to lose baby Dennis. And I told him that whatever we could do to save the other 2, I want it done. That I had read that with people with multiples, after once delivered, the cervix could close back up. And if that was a possibility, I was going to do whatever it took to save, even if I could only save 1.
Yeah. So tell me about November 30th.
Dr. Leaphart came in that morning, told me that she realized that I had made some statements that I was upset that she kept pushing Pitocin on me. And I told her, yeah, I was, because I'm not doing it. If I had to save my babies on my own, I'd do it on my own. She told me that she's sorry I felt that way, but she had to offer the Pitocin. And I told her I didn't even want to hear the words Pitocin. At that point, she left. That morning, I lost my mucus plug. We had to ask a nurse to come in to verify whether or not it was the mucus plug or not. So shortly after that, contractions started. Later that day, I asked if, since the contractions had started, if there was still a possibility that they could help baby Dennis be delivered without me having to push to save the other 2. And Dr. Shepard told me if I don't push through the contractions, there is a possibility that my cervix would close back up and I could save my other 2 babies. Later that night, contractions started really hard, and I had to go to the bathroom, and I didn't even want to go to the bathroom. I cried because they told me that even at 4 centimeters dilated, my babies could just fall out, so I didn't even want to get out of the bed to go to the bathroom. So I cried until my mom finally went and asked the nurse to come take me to the bathroom and stay in there with me while I went to the bathroom. And instead, the doctor came in and told my dad that I could deliver the babies on the bed, that it didn't matter, that they didn't have to be present, that it wouldn't change anything.
What happened on December 1st?
At that point, I was already hooked up with an epidural. Again, they were keeping me pretty heavily medicated with the Ativan, the Stadol, the epidural, the morphine. So the first is kind of a blur. I honestly thought baby Dennis would have been born that day, just because of how hard the contractions were, but I was still fighting not to push through them.
At what point was baby Dennis actually delivered?
He was born December 2nd at 4:04 p.m. That Friday, he was finally born. Around 3:30, I just told my sister that something didn't feel right, and I felt like the baby had dropped. That more of him was out than just his arm at this point. So she went and helped the doctor, because the whole time we were there, we had to hunt the doctors or the nurses down, and they never just came into the room. So my sister went and had the doctor come in. And she tried to do a manual exam, and she couldn't. She said that the baby Dennis's arm was in the way. So she tried to do a speculum exam, and they weren't able to visualize anything. They had already told me the night before I was fully dilated. I was 10 centimeters dilated. So she used one of those break-apart speculums and was able to see, but she didn't have enough light. So one of the nurses pulled out her cell phone and used the flashlight on her cell phone. And Dr. Shepard just looked up and told me, she said, "You have to push." And there was just something, her facial expressions had been different than that whole time. And I cried, and I told her I didn't want to. I didn't want to push. And she told me that I have no choice, that I had to at that point.
And tell me about the birth of the other two.
Honestly, I don't even remember having them. I remember after I gave birth to baby Dennis that when they first gave him to me, he smelled so bad of an infection. But I didn't care. So I held him.
And were you being administered any antibiotics at that point in time?
No. So after I got him baptized, I gave him to my mom and dad to have him baptized. And I passed out. I don't remember anything except for some time afterwards. I went to move in the bed, but I felt like I was so drugged. I couldn't, you know, when you're in that drug state, you can talk, but you don't feel like you're comprehending anything.
Right.
And I remember telling somebody that I felt like the other two babies had came out. And somebody lifted my sheet, and I pushed it back down and told them that they were going to make my babies get cold. And then I don't remember anything after that again. I passed back out. Shortly after that, I remember waking up, again, not able to even open my eyes, and asked my dad where Calissa was and what was wrong with her. And I don't even remember the answer. I found out later that Calissa had a heartbeat when she was born. And it wasn't even me that held her when her heart stopped. It was my 12-year-old niece that had my daughter when her heart stopped beating.
Describe for me the events of December the 3rd.
I woke up at about 9 o'clock in the morning. And it said I don't remember Johnathan or Calissa being born. So the first thing I see when I wake up was all three of them sitting in the incubator right next to me. I remember yelling at my daddy to get up because I wanted him. I felt like I couldn't move. I felt like my legs were paralyzed, that I couldn't even move to reach the incubator. So I had to wait until he got up to hand me the babies. The nurse finally came in and unhooked the blood pressure cuff, took the IV out of my arm so that I could get up and move around and hold the babies. And I remember just sitting there and just holding them. Dr. Lee Park came in and told me that I was being released and I could leave whenever. Just whenever I was ready, I was free to go. So they did, a photographer came in and did photos of the babies. And then we got their handprints and their feet prints and their measurements. And then the funeral home came to take them away.
Okay, tell me about your homecoming from the hospital.
I had to leave the hospital no way a mother wants to. I had to leave with my children in some stranger's vehicle in a box, and I went home empty-handed. I didn't go home right away. I came to my sister's house first because she offered to cook dinner. We started planning what needed to be planned. Babies' cremations, their memorial services. Couldn't eat. didn't feel up to eating. So I spent the next couple days just going over everything that needed to be going over. I didn't sleep. I was terrified to sleep. Something just didn't feel right. I felt if I went to sleep, I wasn't going to wake, because I just didn't feel like me after all the medications and everything else. I just didn't feel like me, and I felt like if I went to sleep, I wasn't going to get up. So I started reading through the medical records to see if there was anything that I needed to be able to get. Obviously, they wouldn't give birth certificates, but to get something for their death certificates, or whatever I needed for the cremation services, so that I could visit the funeral home on Monday. And in doing so, I was looking over my discharge papers to make sure, to see what all I needed to do, because I'd been through several friends and sisters' births, and they usually give you care instructions, that certain soaps to use, or so I started looking over my discharge papers, and there's some strange things on the discharge papers. It talked about I had an incision, and talked about how that I needed to make sure my incision site was clean. It talked about the MMR. So there was a lot of things that didn't add up with that, on top of not wanting to sleep. So I decided I was going to pull my medical records.
What sort of things did you find out when you started reviewing those records?
A lot of things. I got my medical records from the hospital, and only the hospital. We had found out that, first I went and pulled the medical records from the hospital, and they gave me a very short thing, only 48 pages. And I remember saying that it just didn't seem like that was a medical record. I studied nursing for a while, and I know note-taking and stuff like that for a week. It was weird. But in there, it had some of my blood work and some of my labs, a few of the doctor's notes, and my labs just, I'm not a doctor, but just my lab work from the little bit of nursing school that I'd studied just did not add up to what they were saying.
So what did you learn when you really started reviewing the results of those blood tests?
Like I said, I'm not any kind of doctor or anything like that to review them, but I have several friends that are nurses and stuff like that I started questioning the blood works, because I had a lot of highs and lows. I've actually got them right here. I wrote them down. There was a lot of highs and lows on here. So I started asking some nurse friends of mine what those highs and lows meant.
Mm-hmm.
And a lot of those highs and lows are indications of infection, or extreme anemia, or I forget exactly what it's called, but it's the anemia where your red blood cells just absolutely refuse to start creating red blood cells. And it's harder to treat that type of anemia and things like that. So I tried to get medical records from all of my doctors that I had seen during my pregnancy. However, Savannah Perinatology has, so far, even to this date, has still refused to give me any copies. So all I have is the medical records from the hospital, but the blood works that they've done and the research that I've done on them, there's every indication of anemia, infection, liver problems, some of the kidney problems. And with me being diabetic, none of that was making sense to me on why those were high or low.
Okay. Now tell me about what happened on December 19th.
On December 19th, I ended up going to the emergency room because I went to my 2-week postpartum checkup at Savannah Perinatology, which when I went to that 2-week checkup, I told them that I was still passing tissue, and I was still getting a smelly discharge. It just didn't smell right. to the point where, as bad as it sounds, I would even take, I put the toilet paper up there. I mean, it was off. There was something wrong. And the only person I got to see at that postpartum checkup was Angela again.
So you did not see a doctor at that time?
I had to request one
Okay.
afterwards. So I saw her and she was like, oh, that's all normal. And I told her, I said, I want to talk to the actual doctor. And Dr. Reddick came in and I told her, I said, I'm still passing tissue. I'm still got an odorous discharge that doesn't smell right. And she said that it was a good thing that I was still passing tissue. It means that my body was clearing everything out. So my dad went with me to that checkup and asked them, well, aren't you going to do an exam? Don't you need to do a pelvic exam? Because when I lost my twins, my fertility doctor had me back in 2 weeks later doing a pelvic exam to make sure my body had, gotten rid of all the tissue, that there was nothing that could cause any problems or anything else. And she told me, no, I didn't need an exam. They just wanted me to come in to see how I was feeling. So on the 19th, since I had that odorous discharge, I went to the emergency room under the advisement of my sister that, it just wasn't right. And I went in, they took a urine sample and came back and told me that my white blood cell count was extremely high. They expected to be 5 or less, and mine was at 30. And basically wrote it up as a UTI and put me on macrobid. And then told me to follow up with my primary care physician.
Which you did on the 21st, correct?
I called him on the 21st. I actually went in on the 23rd because of their scheduling. And at that time, he had took a urine sample too. I asked him to run a complete blood panel because of all the blood work from the hospitals just wasn't adding up, that there were signs of infection. I even took my medical records into him, and he said everything was okay, but did a urine sample anyway and found out that I was still having this infection, and put me on a secondary antibiotic to try to get that cleared up.
And did it clear up?
No. I ended back up in the hospital on December 31st. I actually went down to Wayne Memorial because I felt that the care that hospital gave was a little bit better than our local hospital. And when I went there, that doctor actually sat down and listened to me tell him that I had never had any antibiotics in the hospital, and at this point I had received the pathology report on the baby's placentas. And it said that the cause of their death was basically because of an infection. So I took that records up to the hospital with me and told that doctor what the infection was that the baby's placentas had. First question out of his mouth was, did I have antibiotics? And no, I didn't. So he did an ultrasound, a pelvic exam, found out that I had an entire uterine cavity infection. So he gave me a shot of some kind of antibiotic and then sent me home with doxycycline and metronidazole or something like that. So I was double antibioticing for this infection.
So what was the infection that was determined by the pathology report to be the cause of death?
Their baby Dennis and baby Calissa had severe chorioamnionitis, and baby Johnathan showed a hemorrhage that prevented them from determining if he had the infection as well or not. Mm-hmm. So obviously nobody's explaining this to me when I got the pathology report. So I was doing a lot of research myself, and didn't look good. Said that it could be caused from a untreated infection that could cause your babies to get it. The membranes being ruptured for too long without antibiotics could cause it. said that after, and this is from multiple websites, I've even, like I said, I've asked nurse friends, that if you were not treated for it in the hospital, that it can cause maternal sepsis and prevent you from ever having children or even kill you.
And your OBGYN had the pathology report, correct? Yes. Did they ever review that with you?
They finally did on January 6th. I was called to go over the report, and she made it out to be like it was nothing. I asked her if there was any kind of repercussion to me, and she made the comment, no, since you were on antibiotics in the hospital, that it was fine. And I had to inform her I was not on antibiotics in the hospital. And her being my OB-GYN, but again, this is just Angeline calling. It was not an actual, my OB doctor, it was just their nutritional educator and their preterm labor educator calling me to go over the pathology report. And I even asked her, I said, well, because at this point I knew that the infection had carried on. And I had asked her, is there anything that I need to be concerned about for my health? No. I asked her if there was anything I needed to be concerned about if I tried to get pregnant again. No. It's not a reoccurring infection, but make sure you tell your next OB that you've had this previously, was pretty much the conversation that they had. I was told that it was a common thing to have, that it's so common to see that as the cause on a pathology report.
Now, you mentioned that you've done some research on chorioamnionitis.
I have.
What type of symptoms? Are there any symptoms that perhaps present that you might have experienced?
Well, one of the symptoms is uterine cramping, extremely fast heartbeat. Babies can have an extremely fast heartbeat. Looking it up, if it was greater than 160 in the fetus after your second trimester, that it could be a sign of it. Temperature, but the number one indicator of it is high white blood cells.
Which you actually did have.
Yes. Mine was at a 14.4.
Okay. What about fever?
It says that you can run a fever. I never experienced it. I don't run fevers with infections. It's been in my medical chart since I was probably 2 years old. I had my eardrums rupture, and the only reason my mom knew that something was wrong was because she smelled the infection when she was hugging me and took me to the doctors. Still never ran a fever, never pulled at my ear to show that it was painful. My mom just knew because she smelled the infection. So I don't run fevers or...
And you made your doctors aware of the fact that that's your personal physiology?
Yes.
Okay.
And that's actually why I brought up the cramping in my OB appointment, because it's not normal for me. All I kept getting told was, that's normal, stretching, cramping, things like that. If it's not normal, come and see me. I don't know what's normal. I don't have pain receptors. So what's normal for you might not be my norm. My norm's no pain. So when I feel the pain, there's something that concerns me.
So, white blood cell count. When you reviewed your medical records, you found out as far back as what date were your white blood cells elevated?
Like I said, I haven't gotten all my records from Savannah Perinatology, but I did have some of their records mixed in with the hospital records, and as far back as October 12th. I had a high white blood cell count, high neutrophils. I had the, on the charts for October 12th, Angela had noted that I was at an extreme high risk for UTI. Because of that, because my urine was cloudy, I had high white blood cell counts.
And that wasn't the only time your white blood cells, that those numbers were elevated?
No, they stayed elevated throughout my pregnancy, throughout every appointment.
Did anyone ever discuss with you the dangers of infection?
No.
And were you ever introduced to an antibiotic?
No. The only time my blood was drawn was on the 12th. And then it didn't get drawn again until I went to the emergency room because of passing the clot. And then the day I was administered into the hospital, they drew blood. And then on the day the babies were born, they had drew blood. And all of them was elevated.
So so just to be absolutely clear, the OBGYN staff, Memorial Hospital, Savannah Perinatology, none of them ever recommended that you be administered an antibiotic?
No. Like I said, Angela assumed that I was administered antibiotics in the hospital. But like at that point, I had already had my medical records with every list of medication I ever had administered during my hospital stay. And all that's pretty much on there is painkillers, and that's it. No antibiotics listed.
What about Pitocin? Let's talk about Pitocin for just a minute.
When I first pulled up my medical records, it just showed that it was administered. So I wanted to dig further because remember I told you I just had that little abstract piece of information. So I went back and had to ask for my full electronic medical records, including my MAR, the medical administration. So when I pulled that, it showed Pitocin was not given until my abstract just shows that it was administered. It says continuously in the IV drip. But according to the MAR from the full records, it says it was administered at 12:19 after my babies were born.
Okay. To your knowledge, or at the time you started researching this, was there any reason for Pitocin to have been administered at that time?
I started researching it. They say Pitocin can be used as part of a hemorrhage protocol. That if you have lost more than 500 cc's of blood, that they can use that to speed up the contractions to pass the placentas quicker to reduce the blood loss.
More than 500 cc's.
Mm-hmm.
About how much blood do you know?
Oh, I know from my medical records exactly how much I lost. I lost 376 cc's.
Okay.
And that was even after the placentas had already been delivered.
So in all reality, there was no reason for Pitocin to have been administered?
No.
Okay. So how do you feel your care was handled by Savannah Perinatology?
After researching the fact that I was never informed that Angeline was only an educator. The way they introduced her at my first appointment was she was the nurse practitioner that handled all high-order multiples. And the way she presented herself, that she would be there even for the delivery. She just doesn't make the C-section cut. So at first, the way she was presenting herself, I thought I was going to have some pretty good care. After having to call a couple times with the scares and always being told the same thing, oh, if it's a miscarriage, there's nothing we can do. They didn't want to come in to see me. I mean, even if it was a miscarriage, I would assume my doctor would want to see me to make sure I pass all the tissue, or, you know, there's no complications, or that they don't have to give me the medications to make me pass the babies. But none of that was ever done either. It was pretty much just, if you're miscarrying, there's nothing we can do to help you. But after finding out that I only saw their nutrition educator and their preterm labor educator, I don't feel that it was, I feel I would have gotten better care at any regular OB-GYN that isn't specialized to handle high-risk pregnancies.
Right. So what do you think happened? I mean, do you feel like you received appropriate care for a woman whose pregnancy was considered high risk?
I didn't, even from the get-go. I was very leery about seeing them.
Okay. Are there any other details that you want to add at this time?
A lot of it is everybody's going to question when you lose a baby. I highly recommend anybody that's lost a baby to dig deeper. we're supposed to be able to trust our medical staffing. And I didn't have that trust from the beginning. To be extremely high risk and even going 11 weeks with no prenatal care, could have put my life in jeopardy. Me being diabetic, me having the high order multiples, it's just, I don't feel that any kind of care that was administered was adequate enough. And that's why I recommend that any woman that doesn't feel that she received the care, pull their records.
What are your plans for moving forward?
I've done some research. They have put out my medical records that it was due to the triplets that I lost them, just because of their weights, that it caused my cervix to open, and they wrote it down as an incompetent cervix instead of an infection. So I've contacted several doctors, not local, to find out a little bit more about the chorioamnionitis, about the incompetent cervix. And the plan is to eventually go to see Dr. Fogwell in Texas, who does a transabdominal cerclage. I've talked to him on the phone. He's actually reviewed all my medical records prior to even becoming a patient of his. Told me that with the chorio, there is a possibility that it will happen in every consecutive pregnancy here on. That since my cervix silently dilated, that will happen every consecutive pregnancy. But with the transabdominal cerclage, he told me he can guarantee me my cervix will be made of steel. So that's the plan before trying the fertility treatments at this point, is to have the transabdominal cerclage to strengthen the cervix, and hopefully be able to go full term. But I am looking at some different maternal fetal medicine doctors, just talking to Dr. Fogwell, him telling me what all they do and how they handle high-risk pregnancies, how often they check blood work, how often they do measurements, everything like that. I may actually even stay in Texas for my entire pregnancy,
Right.
Just because of the way that he talks about the care that I should receive, which was not anywhere near what I got from Savannah Perinatology. So my plan going forward is to definitely find a doctor that I can trust.
Yeah. And finally, just tell me, what do you hope to accomplish by sharing your story?
I want more people to stand up and stop being silenced about it. Infant loss is so avoided. And it's a taboo topic. Nobody wants to talk about it. Nobody wants to see their pictures posted. And I think more women need to stand up for their rights. More women need to stand up and be more proactive in their health care. I wish I had researched more and demanded better care. I kind of went into it blinded and felt that I had to take whatever the medical staff basically pushed on me. The medications administered, when I asked if they harmed the baby, the simple answer no. But I found out later that wasn't true. So I recommend, I want to encourage women to stand up, be proactive in what care they're getting, be proactive in the care that their unborn fetuses is getting, and to stop being silenced by it, to stop being afraid to go against what the doctors want, regardless on if it makes them mad or not, because we know our bodies better than anybody else does.
Right. I'm sorry that this happened. And I thank you very much for taking the time to talk to us about it.